My name is Dr. Kieren Bong. I'm a full-time cosmetic doctor based in Scotland. Today I would like to tell you a little bit more about my 2.9 Eyelift technique. I did not start injecting hyaluronic acid filler until about 12 years ago. But 9 years ago, I decided to examine techniques which existed at the time, as well as instruments that were commonly used at the time. And also as a beginner, embarking on the journey of rejuvenating the infraorbital region with hyaluronic acid filler, I was always insecure about the exact placement of the filler. So having examined those techniques as well as instruments that were commonly used 9 to 10 years ago, I came up with the 2.9 Eyelift. And essentially 2.9 Eyelift is a technique that encompasses 2 entry points. It is a technique that most importantly helps injectors establish exactly the depth or placement of the filler, because that's incredibly important. It is also a technique that takes into consideration the anatomical changes associated with aging process, which we will go into more detail of later. So it is a technique that is a bit of a getting used to if you've been using hypodermic needle to inject hyaluronic acid in the tear trough and infraorbital region, because it utilizes a 25 gauge 50 millimeter cannula. But once you get the hang of it, so to speak, it is a technique that will give you a lot of a confidence in the placement of the filler, as well as a more, in my personal opinion, a superior result compared to existing techniques.